So basically, what's interesting about inflammation? So there's nothing interesting about it. There are potential multiple organ failures, which is definitely not a good thing. And so, what is multiple organ failure? Multiple organ failure is the process where multiple organs in our bodies will fail us um, because of the inflammation and cytokines in the shock states, especially the shock states where vasodilation happens and then the vessels dilate in systemically, which causes multiple inflammation in the body, and that's definitely a problem. So, what are granulation tissues? Granulation tissues are formed by epithelioid cells, which are a type of macrophage that fuse together to form this giant cell called epithelioid, and then these things will line the inflammation sites and form fibrosis and this thing called granulation tissue. And yeah, so there can be a release of exudates, which can also contain neutrophils, dead debris, necrotic cells, both from these neutrophils, which are little cells that kill other bacteria, and also your own cells, people's own cells, which will die as a result of the inflammation, and these cells will coagulate or become this thing known as pus, which is an exudate. It's white, it smells in a certain distinctive way, and it's released. It can form abscesses as well if it collects within this cystic space. There can be some granuloma formation, macroscopically speaking, which happens in tuberculosis, where there's surrounding macrophages. TB is tuberculosis, and it infects macrophages, and this macrophage becomes forms a granuloma. Because it surrounds the focus of infection, and this forms this thing called a granuloma. On the other hand, if you have a chronic cholecystitis, which is a chronic inflammation of the gallbladder, usually due to some kind of things like obstruction, then what can happen is there can be this thing called a fibrosis, just like in the liver as well. Chronic hepatitis can also lead to fibrosis. This is a type of inflammation that happens, and it's not that good. Yeah, so like we mentioned earlier, if you have this thing called granuloma, it's usually an infection that cannot be cleared by your immune system, so it's very resistant, and as a result, so some sources of resistant strains include things like syphilis, tuberculosis, which is a type of respiratory infection that is common in unvaccinated population. It's very common in Japan as well, and other types of things like fungi can also cause the formation of granulomas. And also, if you have a foreign body in your body, then this cannot be cleared easily by your immune system, right? Or can it? Do you think it can be? No, it cannot. So as a result, it becomes this granuloma, right? And so some sources of these granulomas include necrotic bones and these what do you say, like sequestras, which are types of necrotic bones. Uh, if it's exogenous, it can be industrial waste products like asbestos or silica dusts, which are types of dust that you get from exposure to dust. Apparently, if you take some certain drugs like allopurinol and sulfonamides, this can also cause a formation of granulomas, which can happen. And also another disease like Crohn's disease, which is an inflammatory bowel disease, which kind of autoimmune slash idiopathic, which means that it's not really known what the cause is. It just causes inflammatory skip lesion within your digestive tracts, and it causes diarrheas, some basically some inflammation, malabsorption, painful abdomen, things like this can happen. And Crohn's disease, also if you have sarcoidosis, which is so sarcoidosis is a general term that refers to any granuloma formation systemically. It's usually forming in lymph nodes and the lungs due to the breathing in these silica dusts and asbestos, as well as other carbon dusts. But it can also form in other organs such as the heart and other parts of the body as well, and it's called sarcoidosis. So what is Wegener's granulomatosis? So Wegener's granulomatosis is a type of granulomatosis. So granulomas within the kidneys. So Wegener's granulomatosis is the old name for the granulomatosis with polyangiitis. It forms granulomas, like we mentioned, like sarcoidosis, within the lungs, kidneys, skin, sinuses, throats, and it's a systemic disease known as vasculitis, and it's usually due to autoantibodies against. And this disease, it can lead to things like hearing loss, kidney damage, or lung scarring, skin scarring, nose saddling due to a weakened cartilage in the nose bone. And so what is infection? Infection is when it can be any agent, things like bacteria, viruses, parasites, fungi, invade your body through an opening or breakage in the mucosa or the skin or any type of surface in the body, and it will invade your body and cause inflammatory reaction there. And so this is a type of infection, and the problem is that when it invades you, it may multiply within your body using your resources within the body and may form colonies or start replicating. And this results in systemic responses in the body, such as fever, weakness, fatigue, weakness, all these types of reactions. So yeah, we got all sorts of infections. You got appendicitis, acute appendicitis, which is usually due to multiplication of bacteria within the appendix due to like an occlusion with a fecalith, or it can be anything like pancreatitis, which is usually not an infection but causes inflammation. It can be things like urinary tract infection, which is usually due to E. coli, and it's usually ascending, meaning that it comes from the external, and and it multiplies within your bladder or your urethra, causing ascending infection towards the kidneys and pyelonephritis. You can have pneumonia as well, community-acquired pneumonia or hospital-acquired pneumonia. I mean, many different causes, viral, bacterial causes, and so some, according to this notes, as well as in every other environment in our world, there can be so many causes of bacterial infections. Things like staph, strep, sometimes Klebsiella. Atypically, there can be chlamydia or mycobacterium. It can all cause pneumonia, which are atypical, and usually if it's typical bacteria, then like staph, strep are all causes of these infections, and these are usually due to invasive, and you can cause a multitude of infections. And we're right now referring to surgical types of infections. Pseudomonas is a type of opportunistic infection in patients who are immunocompromised, and people who are immunocompromised, Yeah, you can even classify infections, surgical infections, based on things like extrinsic, intrinsic, or opportunistic, like we mentioned. Um, Pseudomonas, the type of opportunistic infection that happens when you are immune compromised due to some certain treatments or drugs, cancer, when your immune status is reduced. There can be exogenous types of infections, and in this case, you usually have these yeah, like pneumonia, like staph, all these things that are present within your mucosa. While in endogenous, it's usually due to things like within your gastrointestinal tract, where it's ruptured during surgery, and there's a spillage and there's a contamination, and this causes things like peritonitis from the wound of, and it makes it dirty, basically. Finally, we got external infection or exogenous infections, and in this type of infection, we must refer to things like tuberculosis, or diphtheria, polio, all this exogenous people, things that you acquire from other people or from the environment, from the soil, from the from other animals. Like all these are exogenous types of infections. So there are some factors within our bodies that can actually worsen the infection compared to people who do not have these factors. And these factors include things like hygienic status of within the hospital environment, things like hand washing, hand sanitization, masks, surgical gowns, a sterilization of instruments. These can contribute to that immune status of the patient. If he's immunocompromised or if he's malnourished, then this can also suppress his immune system. He can have other underlying conditions like diabetes, tuberculosis, hypertension, all these things that can actually reduce his ability to cope with infections. They can also be things like, yeah, open wounds, surgical wounds, or other types of wounds. Closed wounds usually doesn't um, contribute to infections, while open wounds, where you have an exposure towards the external environment, can lead to infections from your body mucosa or fluids. I mean flora. Yeah. Also, if you have a foreign body dislodged within your body, like cannulas, um, some wounds like bullets, if you have some nails, if you have syringes, if you have catheters, Foley catheters, all these things can form this thing called biofilm, which is a coat that protects the bacteria from other immune cells like leukocytes that can can't invade this biofilm, and as a result will worsen the infections. And one thing that's very important for infection is how much bacteria you get from being exposed. And for example, if it's foodborne, then there has to be a lot of bacteria in order for it to cause a viral illness, because if it's too low, if the dosage is too low, then it usually doesn't affect you. Like it doesn't, it gets cleared by the body. Whereas if it overloads your body, then usually this can actually cause a problem. There's also different types of transmission. It can either be through the air, it can be through direct contact with the wounds, it can be through within the body after infection. It can spread through the blood, through bacteremias, or through the lymph vessels and nodes. It can spread through tissues directly, and it can you can also classify these infections during surgery. It doesn't necessarily look differentiate. Doesn't necessarily refer only to surgery, but it can also apply to other types of infection. It can either be a localized inflammation or systemic infection. And localized, it can be things like carbuncles, furuncles, cellulitis, um, erysipelas, appendicitis. And on the other hand, the more generalized form is things like bacteremias and sepsis, where there's a systemic inflammatory. It's more dangerous because it spreads throughout the blood and cause vasodilation and shock in some instances, and seeding towards other organs and tissues and other parts of your body, and this is problematic in a sense and may need more systemic treatments, systemic antibiotics, systemic stabilization of your vital signs, all this type of thing. So what is strep infection? So in strep infection, you can get a condition called erysipelas. Apparently, erysipelas is the infection of your skin, causes redness and pain due to Streptococcus pyogenes, which is group A. There can also be other types like group B, which usually causes teeth from teeth extraction, causes heart, like things like strep viridans, but that's not really common. And erysipeloid, uh, due to things like bite wounds. Sorry, not bite wounds. You can also get this thing called cellulitis. It's also caused by group B strep, just like in erysipelas. And there's, you know, so when you have cellulitis, you have to treat it with penicillin because apparently penicillin works effectively against group A streptococcus, which are beta hemolytic. And yeah, if it's obseding, if the erysipelas or the cellulitis has abscess in it, then you may need to incise the wound or the abscess in order to drain the wound and insert a drain there to keep the pus out. We can also talk about lymphangitis. In lymphangitis, you have a condition where the vessels of the lymph vessels are inflamed, and usually the lymph is connected to this area of cellulitis, and that is actually the reason why it causes lymphangitis. And as a result, there might be red streaks that lead away from this cellulitis area that's infected with the strep pyogenes. And when the lymph vessels get inflamed, usually also the lymph nodes get inflamed, and as a result, it becomes painful, tender. It's movable and not hard, and it's enlarged. It's different from any types of cancer or anything like that, which are usually painless and hard and not movable. So you can basically classify disease also according to acute inflammation versus chronic inflammation. The problem with acute inflammation is that it can lead to systemic infections because of the increased viral or load, while in chronic infections it's less likely because of the chronic nature of it. And one of the treatment methods for these primary infection, which means the first site of exposure, things like open wounds, ulcers, surgical sites, all these things are primary wounds or primary sites of infection, and these are usually usually the sites, and you have to immobilize these sites because if you keep moving them, then the tendency becomes that it causes or it encourages the spread by this pressure, and yeah, so that's not good. So you should immobilize the area, and plus it also hurts, so it's usually done in this way. Surgery may be required if severe. The localization may be things like abscess, um, things like open wounds, things like folliculitis, furuncles, carbuncles. So next, I'll try to talk about deep infections. What are deep infections? For deep tissue infection, we can talk about abscess. Okay, so in abscesses, it's like there's a deep tissue. This invasion usually it's sterile, there's no bacteria in it, but then sometimes during penetrating you somehow that there might be bacteria seeded into deep inside the tissue, like the muscles, fascia, bones, osteomyelitis, all this type of things. They cause abscesses within the bone, inside the bone, or within the fascia, within the muscles. It can be very painful. So there can be different types of inflammations or abscesses, chronic abscesses. It can be sinuses or fistulas. Fistulas basically means that there's a connection between the abscess and like an external opening or other organ, aka it's a connection between two epithelial surfaces. The causes of an abscess commonly are mycobacteria and actinomyces. So what is a sinus? So what is a phlegmone? A phlegmone is actually like a site of infection that's not lined by epithelium, and so this is dangerous because there's no closure, so it keeps spreading to other organs and tissues, especially tissues, and yeah, it can lead to a widespread inflammation and even sepsis, which can be life-threatening. So one of the treatments of these conditions is incision, draining these abscesses. So like we said, if it's infected with group A strep, then it can cause erysipelas, and this can go deep. It can cause, all these inflammatory states like sepsis, shock states due to vessel dilation. It can also cause a coagulation due to this. Inflammation causes fibro coagulation and may cause increased deep vein thrombosis and embolization as a result of this coagulation. And there's this state called necrotizing fasciitis, which is actually also called flesh-eating disease. It doesn't have to be fasciitis; it can be myositis. Is when there's a necrosis of these organs that's being infected or inflamed, and can lead to even further widespread state of sepsis. So treatment methods include things like oxacillin, first and second generation cephalosporins. For resistant strains, you can use vancomycin. So the nomenclature for abscess or pus filling spaces, like pre-existent spaces such as the pleura or the joint space, is called an empyema. This is the nomenclature, and for example, the space under the diaphragm is called subphrenic abscess if it's full of abscess. So apparently, if you have a Clostridial infection, then it can cause toxic megacolon if it's severe enough. Clostridium difficile is another opportunistic infection that caused due to antibiotic uses, and it can cause overgrowth of bacteria. I mean, suppression of the flora that usually suppresses Clostridium difficile, but when there's a severe infection with Clostridium difficile, then it can cause sometimes due to obstruction and swelling of the intestines causing toxic megacolon. Also, there can be some systemic responses like shivering, pain, deep pain, restlessness, anxiety. Uh, Fournier gangrene is another word for necrotizing fasciitis. In gas gangrene, so in gas gangrene, right? So when you have gas gangrene, it's usually an anaerobic infection. So anaerobe means that it doesn't like air. So it's not friends with air, okay? So I won't be there for you, air. And when there's no air, right, then uh, organisms like Clostridium perfringens can release this air or this gaseous material that causes necrosis, and this is called gas gangrene, or it's commonly referred to as gas gangrene. So if you're infected with tetanus, you might need some boosters with some antibiotics, stuff like that, because uh, tetanus, Clostridium tetani, which is a contaminant within the soil, right? So these things are often combat. So we have vaccines against it. So you give boosters because that's what you do, right? I'm not exactly sure when you give it, but that's what you give. And you also give other things like, for example, so antitoxins. So the same thing with venoms. It's like an antibody against the toxin itself, and it actually neutralizes it in this way. Or you can also use other substances such so uh, so so for infections with like the gas gangrene thing, Clostridium perfringens, which are anaerobic, you can often use peroxide to clean off it. But it's very important that you clean it off and try to reduce the ability for it to spread, I guess. And if you have lymphadenitis or lymphangitis, then you should immobilize it. If you have pain, then you might give NSAIDs, non-steroid anti-inflammatory drugs for the pain-killing effect. It can either be systemic or oral or local. Um, and antibiotics, like we said earlier, amoxicillin or oxacillins, first, second generation cephalosporins, all those types of things can be used. And obviously, it's important that you drain the pus and perform wound debridement, take off any necrotic cells, and yeah, remove foreign bodies which can act as biofilm. Um,